treating hypertension with the calcium channel blockers. We will start with the mechanism of action for the calcium channel blockers in brief. So, muscle contraction is regulated by the amount of calcium that enters inside the cell. So, to control the blood pressure, we have to control the amount of calcium that enters in the cell. So, that's what the calcium channel blockers helps us with. So, calcium channel blockers, they stop the calcium from entering into the cell, and then that reduces the muscle contraction, which causes the smooth muscles in the arteries to relax and reduces the blood pressure. So this is how the calcium channel blockers helps us to reduce the blood pressure. Commonly used calcium channel blockers: nifedipine, amlodipine, and felodipine. These are the selective calcium channel blockers. Here we have verapamil, we have diltiazem. These are non-selective calcium channel blockers. So selective calcium channel blockers are the channels in the arterioles, while non-selective calcium channel blockers are the channels in both arterioles and myocardium. Nursing considerations for the calcium channel blockers. Number one is baseline data. Prior to starting any client on the calcium channel blockers, nursing should obtain the complete health history of the client, obtain the medical history, check for any allergies that client might have, and also check the vitals, ECG, get an ECG done, and a complete blood work. Grapefruit juice. Grapefruit juice is not recommended with the calcium channel blockers because it may cause a rapid toxic overdose, which is a medical emergency. So always advise your clients when starting on calcium channel blockers to avoid grapefruit juice. Heart failure. Calcium channel blockers increase the risk of heart failure by decreasing the myocardium contractility. Instruct the client to report any symptoms such as edema, increase in fatigue, or difficulty breathing or shortness of breath. Liver toxicity. Because the calcium channel blockers are metabolized by the liver, so there is a risk for liver toxicity. Advise the client to notify the physician any complaints of nausea, vomiting, or change in the color of urine or stool, bleeding, or abdominal pain. Hypotension. Calcium channel blockers may cause a paradoxical increase in chest pain or a increase in anginal pain. So, instruct the client to notify the physician any kind of symptoms such as headache, dizziness, or lightheadedness, and also advise the client to change the position slowly from sitting or laying down. Renal toxicity. Because calcium channel blockers are excreted by the kidneys, so there is a risk for a renal toxicity. So we would advise the patient to report any symptoms such as symptoms of renal toxicity, such as flank pain, or any change in the urine color or decrease in the urine output. So that's all about calcium channel blockers. I hope this will help you guys. Thank you.